Gentlemen from Colombo, Sri Lanka. I'm Dr. Kon from Health Informatics Society of Sri Lanka. We warmly welcome you to the 8th Sri Lankan eHealth Hour, organized by the Health Informatics Society of Sri Lanka in collaboration with Asia eHealth Information Network. We have with us today the Executive Council of HISO. We would also like to welcome members of AHIN around the world. Delighted to see several experts of health informatics, including medical officers of health informatics, academic staff of the universities, as well as postgraduate students in health informatics joining for our webinar today from all Sri Lanka. Thank you all for joining. Is an online knowledge sharing session. Experts in health sharing their knowledge and experience on topics of interest in real time using WebEx platform. Having a presentation by a panel of experts followed by a question and answer session where attendees can actively involve. Sri Lanka Hour will be held fortnightly on second and fourth Thursdays of each month between 12 noon to 1 p.m. Before moving to today's session, I'll briefly mention a few things to note while using the WebEx platform. Once logged into WebEx, the left panel is where you shall see the content presented by the panelists, including PowerPoint presentations, videos, etc. The right panel contains some useful tools. If you click the difference icon, it will display all panelists currently to the event. The button can be used to ask questions from the panelists. You can also provide feedback during the presentation by clicking on those yes, no, too fast, too slow, and after buttons. This phone will be automatically muted once you join in as an attendee. Your mics can be unmuted upon request should you wish to join in a session with audio. If any issues in receiving audio during the webinar, please log out from the webinar and try to relog in. The top impact of electronic health records in Sri Lanka, a study of government hospitals by Mr. Sriyananda Ratnayaka. Lanka is a program manager at the Information and Communication Technology Agency of Sri Lanka. As a program manager of ICTA, Mrs. Sri has been responsible for conceptualizing and implementing several projects which have made a strong impact on Sri Lankan society. Among our projects which have helped access to information, livelihood, education, and health. His the second-class uppers from University of Kelaniya, Sri Lanka. He has a master's degree in economics specializing in project management from the same university. He is also a PMI certified project management professional. And lucky to have him as a resource person for our 8th Sri Lankan eHealth Hour. Over to you, Sri.
Hi, thank you, Dr. Pramod, for giving me a kind introduction. Good afternoon to all of online participants. My name is Sri. As Dr. Pramod mentioned, I'm a program manager of ICT Agency of Sri Lanka. ICTA is a body in implementing ICT for development kind of project for the Sri Lankan government. My topic is the impact of electronic health records in Sri Lanka, and I am honored and I'm very thankful for giving me this opportunity for the sharing this finding of you. You can see my presentation. As we all know,
sorry to interrupt you. Could you please check on the tab button, the quick start button, and please share the presentation again? It's not visible from our end.
Right. Okay.
Yes. Yeah, if you can click on the quick start button and click on the PowerPoint.
Share screen. Okay.
Yes, sir. All right. Clearing. Just give us a couple of seconds.
You
All
can
right,
see it
sir.
now.
Yes. Yeah. Thank you.
Okay, thank you very much. Today, my topic is impact of electronic health record in Sri Lanka, which is a case study we have conducted in government hospital. When we talk about the background, we all know that Sri Lanka is um, uh, it, high life expectancy such as 77.4, and Sri Lanka is well known for its better health indices in southern region. We have a low rate of maternal mortality, 100,000, 41% 6 per 100,000 live births. Low rate of the infant mortality such as 8.5 per 1,000 live births, and we have more than 89% of the population have access to safe drinking water, and more than 85% of population have sanitation facilities. We have the burden of the non-communicable disease have increased rapidly during the last 2 decades. Diseases such as neoplasm and disease on the respiratory system and cardiovascular system have increased rapidly during the last 3 decades. Though Sri Lanka successfully managed the communicable disease such as malaria, tuberculosis, leprosy, dengue is on the rising side due to the environmental and the factor. Electronic health records, we consider the government health expenditure in Sri Lanka. It is recorded between 3.4 to 3.7% of the GDP. A question from the government side, the expenditure recorded around 47%, of the large part of the health expenditure coming from the private sector. Actually, it was increased the last 2 decades. Recorded 53%, and when you take this 53%, more than 80% of the expenditure coming from the individuals out-of-pocket expenditure, and to around 20% coming from insurance and the non-profit activities. Even though large percentage of the expenditure coming from the private sector, we see patients access the healthcare services in ad hoc manner because of piecemeal fashion owing to the cost of the care. When we take the government health sector, we all experience in Sri Lanka, especially in the OPD settings, we experience long queue, maximum of 2 to 3 minutes per patient, and sometimes no time to ask from the patient on their history and allergy and so on and so forth. Sometimes no health information, especially in the OPD settings. We stay long. We have to stay long day to access all healthcare required. So we said that private sector healthcare expenditure has increased, and it is recorded around 53%. At the same time, we said that patients claim that private patients are moving to private sector, claiming the efficiency in the private sector. That is why the expenditure has increased. At the same time, we mentioned that patients access the healthcare piecemeal or the piecemeal manner, ad hoc manner, or with the cost of care. We know that NCD, non-communicable diseases, are chronic in nature, and its demand systematic treatment protocol being adapted to manage the disease. Management of the non-communicable disease leads to worsening the health condition of the patient. Thus, it will lead to worsening the health condition of the patient or the labor force of the country, and that definitely will affect the GDP for the development of the country. So, argument is we really require to manage the non-communicable disease and all this health information. At the same time, we should have the health information to manage the communicable disease as well. So, with this introduction, there's a proposal from the base hospital back in 2010 for implementing a health information system in their hospital. The proposal was submitted by Dr. A.I. Jagoda and the Dr. Seneviratne to implement a electronic health record system in Coronado Hospital. At ICTA, we had a program called eSociety Development, and we had a separate program for giving the technical and the monetary assistance for any kind of government or the non-government or the private organization to develop and implement a system which regards which show kind of problems in the society. So ICTA evaluated this proposal, and we found that supposed to implement a proprietary system. We said that if the proposal can be submitted to implement a free and open source system, EHR system, that can be accepted. So currently, Dr. Jagoda and Dr. Seneviratne, then the RD of the Kegol district, resubmitted a proposal to develop and piloted an open source electronic health record system. I'm sorry, I got a call. Open source electronic health record system in Ronella Base Hospital. So the ICTA facilitate and provide the technical know-how, especially on the open standards, the health. At the time, ICTA provided the technical and the monetary assistance to develop this system, and it was piloted in 2010. The hospital also submitted another proposal to implement such system in their hospital. Then subsequently, this system was evolved, version 1.0 to version 1.4. Then in 2015, we published another which is 2.0, and now a system has been implemented in Avisaville, Dampati, Pandura, Mahoya, and several other hospitals. In the eastern part of the country, the system has been implemented over 13 hospitals. It is implemented by the or the provinces, not by sometimes the ICTA. ICTA facilitates only few hospitals to implement, but since the system is free and open source, the system has been implemented by other provincial health directors. So going back to slide, I would like to show you a small presentation or a small video. Let me share you a YouTube video link.
Quite clean, nice loading. There is no delay or lag. We can see the video.
Shall I share my desktop video, or do I need to share the online thing?
I think the YouTube video you shared, it's quite clear, and can URL all the chat box, then others can see. Yeah, I for you. I can share the YouTube URL. if any of you can't see the, if any of you can have problems in loading the particular YouTube tab that Sri has shared, you can follow this link. I'm seeing it in the chat box.
If you can see this video, this is the this video was shooted before the implemented system. Actually, before implementing any kind of computer system, we need to think about optimizing the existing processes. You can see here the patients are the patients queues are lined both of this corridor, and the patient taken into the hospital and take outside the hospital same corridor. So next, I would like to take your attention on hospital information system implementation was done by the hospital and the hospital staff and the well-wishers of the hospital. So they get together and discuss the matter with then they propose things need to be done, especially on the process improvement. So here the eHealth implementation was a participatory kind of exercise, which was the exercise was participated by the health professionals, the well-wishers, and the hospital health committee. This discussion, they found the need to be improved, especially providing the information and displaying the information of where to go and what to do and so on and so forth. So after that, they submitted the proposal to ICTA to implement the computerized system. But after this stage, if kind of improvements required, they said that they need to use the computer. So the ICTA provided the technical know-how, technical knowledge, and the monetary assistance. The hospital implement their hospital network and implement e-education in their hospital. Doctors here in this hospital are given a laptop and all and nodes are connected to one particular server and a backup server. Patients are given a patient identification card. It is just a one-time registration. Once their information are kept in the server. So not only the OPD have connected injection, dressing, lab, and wards. All admission and discharge also computerized and entered all this information so that we can generate time in the morbidity and mortality report. So I not going detail into this video. I'll go back to the presentation. After Dompe Hospital implementation, the system became quite popular, and there was a request from various hospitals to implement the system in their hospitals. So, we facilitated to implement the system in the hospital, Savela based hospital, and later on in 2014, Another hospital, base hospital was implemented by the provincial director of the Western Province, and many Eastern Province hospital also implemented the health information system, which is released by the ICTA. So right now we are working on the cloud-based HHIMS application, and to have a big like large implementation. We are hoping to implement 45 hospitals within this year in cloud-based architecture. So what is HHIMS? HHIMS is a free and open source hospital health information management system, specially designed for the requirement of the Sri Lankan hospital. In 2010, when the proposal submitted by the Dr. Jagoda and the team, we evaluated existing free and open source system. We found OpenMRS and another free and open, quite popular free and open source system, and technical people at ICTA evaluated.
Can you hear
Yeah.
me? Interrupting, only thing, yes, the viewers these are still seeing the video that you shared. If you want to specifically let them see the presentation, you will have to select it again.
How do I do that?
Yeah, you have to go. Yes, sure. You have to go into that quick start tab, and from screen you have to select the PowerPoint again.
Okay. Or I'm sorry, I have.
Yeah. Other thing I can do is I can deselect the video for all the participants if they have finished watching it.
Screen now.
Yeah. So participants, if you still want to see the remaining part of the video that Sri just shared, you can follow the URL that I have typed in the Q&A or in the chat box. I'll be closing the video tab for now, so that Sri can move on with this presentation. Sri, you can go ahead.
I'm talking about what is HHIMS. I hope you all can see my screen now. HHIMS is free and open source hospital health information management system, specially designed for the needs of the Sri Lankan hospital. Talking about why we have selected something to develop from the scratch. When the proposal submitted by the Dr. Jagoda and team, we evaluated the existing free and open source systems such as OpenMRS and there's another one, and we found that the station is really required to implement those two systems, and the load of the customization again is really big, rather than implementing something which is from the scratch. So that's why we actually attempt to evaluate the requirement and get the scope and build something from scratch. Actually, use some existing databases which was facilitated by the WHO 2006. The tsunami, they have implemented a system called Eastern Province. Some of databases which was already published by the WHO also was used to develop HHIMS. The system was developed by Lunar Technology. So HHIMS comprise electronic medical records, computerized order entry, management system, laboratory information management system. Show you. I hope you will without any disturbance. About the e-hospital concept, coming back to my presentation and the research, the question of this research was to extend the adaptation of the electronic health records, improve the quality and the efficiency in the government healthcare service. We drew the sample from the Dabandaniya Hospital, Mahaway based hospital, Avisavel based hospital, and Dompe district hospital. Mixed qualitative and quantitative method. We use data collection techniques such as questionnaire, focus group discussion, KIAS, and sometimes the telephone interview. The target audience of this research was the medical staff, health service staff, and the patient, and even the individual beneficiaries. Research was focused on the level of awareness of the information system, level of usage of the information system, or not. User believes that there are benefits from the health information system, whether users are aware of the benefits of health information system. The users believe that the health information system is sustainable, critical success factors according to the user beliefs, and the negative impact of any form due to the health information system, and the usability and operational difficulties, the operational benefits, and the challenge in user HHIMS. Found that more than 81% patients said that they are accessing the hassle-free, quality, and speedy healthcare services owing to the health information system implementation. And another large portion, which is 59%, said that no need to repeat our details because the details on the informations are there in the doctor's computers. 35% said that the case enhanced by the doctors with optimum implementation. And 3% of the patients have mentioned that they think it is beneficial them to get the service from the hospital, which has a health system. Among 93% that experience reduction of the waiting time to the health information system implementation. 59% said that they believe that the health information system enhances the quality of the healthcare service, since the records will be reviewed by the other doctors in a future day when the same patient visits the hospital. 93% of the patients believe that there are no negative impact, and 7% said that there are negative impacts with the system failures. Back to the results again, usability and the operational acceptance play a major role in implementing any health information system in any part of the world. So these are specialty answers and the results from the 8% of the system users rate the health information system as easy and usually, and 99% of the system users are familiar with the system. 94% of the system users believe that they are benefited through the health information system implementation, and 70% of the health staff believes that the health information system implementation resulted the reduction of the patient waiting time. 52% mean that there is also paved the path for the hassle-free health services. More than 50% of the health staff means that availability of the electronic medical records create an environment to improve the quality of the care. The limitation. When this study was conducted, found that any hospital we have done this research, they were really busy with day-to-day teamwork, especially the medical staff, nurses, and the pharmacists. They are busy with the work. We found only limited time to interact with them and ask this question. We can go in detail and have a lengthy discussion on impact. Three hospitals, especially the three hospitals have implemented the health information system only in the OPD and clinic section, and Dompe has implemented the system in covering the inward section as well. So results which we have mentioned earlier is some the OPD and clinic from hospital, part of this Dompetic hospital. And now we found that system implementation in clinic or limited to clinics such as medical clinic and the family medical clinics. So these are some patients. So time for the Q&A.
Yes, very much, Sri. It was a very informative, elaborated presentation, and you surely inspired the audience with your presentation. I'm sure the audience must be having a lot of questions to clarify from Sri. Please use the Q&A button on your right panel to pin your questions. We'll try our best to accommodate all the questions, and we can also provide the facility to ask questions using voice, provided you're having a good internet connectivity and minimum background disturbance. In the box if you are available for connecting via voice, and we will also be forwarding the presentations done by Sri after the eHealth hour. Moving on to the Q&A session. Now, Sri, first of all, we have a small clarification to make. The results of the research that you mentioned, was it obtained only from Dompe? And I think you mentioned in the latter part of the presentation that it was obtained from 3 hospitals. If you can please quickly elaborate on that, please.
The survey was conducted in 4 hospitals, Dampinia, Maya, Avisavela Base Hospital. So, 3 hospital and 1 district hospital.
Thank you for that. And we have a question from Oshada Samarasinghe, and he asks, what is the coverage of EHR systems in Sri Lankan hospitals? It's a rather a general question. What is the coverage of EHR systems in Sri Lankan hospitals? With best of your understanding.
As far as I know, in recent past, like last 2 years, the EHR or health implementation now has been accelerated. I know Ministry of Health and ICT and even the provincial health directors are implementing a system. So I'm not going to talk about one particular system such as HHIMS, but that it is now boosted. Like last 2 years, the system implementation in the government hospital was boosted by all these stakeholders. It may not be a kind of a comprehensive EHR solution, but small things are happening, and it's a really good thing. But before that, before 2010, I know that even the research findings, when I do a literature research, I found that there were a couple of instances where the EHR solution implemented after tsunami, but the coverage wise it is very limited and negligible.
All right. The next question it says, what is the attitude of health staff towards EHR? Shall I question is not that clear? I'll repeat again. What attitude of health staff in Sri Lanka towards? Shall I repeat again? What is the attitude of health staff of Sri Lanka towards EHR systems?
Voice was breaking. I think your question is, what is the attitude of the EHR implementation? Is that?
Yeah, actually,
Okay. Yeah.
to repeat the question, yes, it's about the health staff of Sri Lanka.
In 2010 to 2013, I found little bit of resistance in implementing EHR solution owing to the privacy matters, and even there were concern about the privacy, and we know that the health sector is really the privacy is one of major thing we need to think about. So, but back to today, some of questions the professor raised we have addressed. At the same time, the professionals also now consider the importance of the having information, but those days in 2010 to 2013, when we implement the system in some of hospital, we found that the hospital staff is really keen on implementing the system because they are benefited, especially the staff are benefited, but the outside people sometimes found some concern on the privacy matters. But having implementing several pilot hospital and knowing the results of the EHR implementation, now most of professionals realize the requirement of the implementing EHR and having all this patient information for the betterment of the patient. So, attitudes is little bit changed. I think when we are going to implement the big program this year, there will be a great change of the perception of this EHR implementation. At the same time, the concern on security and the privacy matters will be addressed by the professionals like the ICA and even the CSR and the Lanka government, LHII, Lanka government, and so forth.
Yeah, moving on to the next question, we have Samira Vijayaratna from Dialogue willing to get connected with voice, and he has been really helpful for all our eHealth work in recent past. Samira, can you hear me? Yeah.
I hear you.
You
can hear me, right?
Forward your question.
Yeah. Okay. Thank you very much for the presentation, Sri. Interesting one, and I enjoyed it. Two questions actually, since you mentioned the privacy as well. Now, I see most of the implementations are in rural areas. So I'm not so sure whether people have actually realized the seriousness of the privacy of their privacy, their information and all those. But I don't think that why I said is I don't think that this rural people may not be that sensitive. So so my question again, actually two parts. One is, if we move beyond this rural and if we come to urban areas, and if we implement solution in urban areas, sometimes the feedback on this privacy come from the end users may be different. So I like to get comments on that. Plus on Dompe. Now we hear a lot about Dompe. So beyond Dompe, I would like to get your future plans, future vision to go on Dompe.
Yeah. Thank you, Samira. Thank you for these two questions. Answering the very first one, throughout this our research, we found that even in the rural people, they have concern on their privacy issues. Though we have not mentioned in this presentation, we have found that around some percentage they have mentioned that their information will be vulnerable since it kept in the hospital servers. It is not mentioned in this presentation. It was a small percentage. The Panajura and the Avisavella are not both are not rural. These two hospitals are even can consider as urban or semi-urban. right? But privacy issue, still I consider that because this the information are kept in the hospital servers, the access the servers who can access the server can sometimes take the information. So the access has been only given to the sector or the MS of the hospital. But once we have the network system in the cloud-based environment, this vulnerability is further reduced. So, answering the first question, there is no like now the urban or the rural. Now people know the benefit of the ICT, and even in the rural village, they use the smartphone and they know the vulnerability of the information. They have this was mentioned even in this research also. The answering the second question, beyond the Dompe or beyond the Avisavela or the Panadura, what is next step? The CTA and the ICTA has been given a special budget vote to implement the digital health across country. It has been discussed in the portfolio level, and we are planning to implement 300 government hospitals to be connected in cloud-based environment, having a virtual private network and having secured data communication among these hospitals. So within 3 years, it is planned to connect 300 government hospitals. All these 300 government hospitals will be big hospitals. Like when you take all these healthcare providers, like the government healthcare providers, starting from the ministry hospital and the teaching hospital and the base hospital, all these hospitals will be covered with 300, and left out would be the hospital like district hospital, B grade or C grade. So the plan is to connect 300 government hospitals, the big hospitals. At the same time, it is planned to connect all these hospitals with 100 Mbps VPN connection to the government cloud. At the same time, it is proposed to provide the virtual server for each hospital, them to implement any kind of ER application or any kind of a solution in this server. So for doing that, now it is planned to implement 45 government hospitals within this year. So at the same time, I want to mention that so the capacity building would require for implementing this kind of program. So we are going to train a big number of healthcare workers, health staff on the IT, and especially we have planned to provide professional certificates such as network and database and so on and so forth for especially for the healthcare workers, healthcare staff. At the same time, we are to provide with this year we are going to provide and we are going to connect all these 10 of all 9 provinces and the ministry with video conferencing units. That's some of plans.
Thank you.
Yeah, else you want to clarify?
No, I know it's a challenge to come to sort of, let's say, the biggest hospital, maybe in terms of the implementation. But this 45, what you mentioned in the 2016, Sri, there be at least, like, let's say, one teaching hospital or one hospital? Maybe remember in eHealth Asia we were discussing about Kandy hospital, it has in general hospital. So will there be a hospital of that scale in this 45 in this 2016?
Yeah, we have already requested the list from the Ministry of Health, and Director of the Information, Dr. Champika Vikramasinghe, has shared the list of the hospital. At the same time, we are discussing with the political authority also for the selection of these hospitals. It will be mainly done by the Ministry of Health and the related officers. And we are right now talking to the Ministry of Health to set up a separate unit to manage all these various kind of things. So definitely in this implementation, like the 45 hospital will be included, the big hospital. Big hospital mean base hospital, or can be either it can be a teaching hospital. Definitely it would be it would be the big hospital, not the small hospital like district level hospital. And right now we are now working on doing a small pilot with 3 hospitals. That 3 hospitals will be implemented within 3 months, and so that would be the pilot having the system in the cloud-based architecture. The learning will be applied for implementing other rest of hospitals. So 3 hospitals are big hospitals.
Okay. Right. Thank you, Neeraj. Moving next question. Actually, since you mentioned something about what we have an input from Masanka Vishwanath, we must prepare a separate ward for allocations from Ministry to health institutions in Sri Lanka. He has mentioned it's his personal opinion. It will provide more help to manage IT services in institutions. Okay. It's just an input from Masanka Vishwanath. And Sri, do you have anything to comment on that, or shall we move on to the next question?
I move on to the next one. Yes, I totally agree with that.
We have the next is from Pradeep Pereira. Do you think the participation of a separate category of medical officers with training in information technology is needed for introducing eHealth concept in Sri Lanka, or can the IT sector handle this task alone? I'll repeat the question. Do you think the participation of a separate category of medical officers with training in information technology is needed for introducing eHealth in Sri Lanka, or can the IT sector handle this task alone?
I would say we are blessed to have this the trained doctors on the biomedical informatics. Actually, if you are to go with only with the private or the IT sector, the domain expert knowledge is really required, at least to understand the ethical background of the health is a really big one. When we have the trained doctors, especially on the information, having MBBS and having another the degree on the health information is a kind of a blessing situation for us to implement any kind of eHealth implementation. If you are going only along with the IT professional, it would sometimes maybe faster, because when I'm implementing just implementing like the network system in the hospital, I found that the professional just think about the just doing the work according to the plan. Sometimes may not think about the situation in their hospital, and even drilling a wall some may disturb the patient in the hospital. So there are much of things to consider, like two different kind of background. We really require to have the domain expertise, the health domain expertise in the IT field, at least having a small bit of the IT knowledge to implement any kind of eHealth solution.
And especially thanks for that positive remarks on the health, medical officers in health informatics. Moving on to the next question, it's from Oshada Samarasinghe, and he asks, what are the main barriers for implementing e-solutions in Sri Lankan health sector? I'll repeat the question again. What are the main barriers for implementing e-solutions in Sri Lankan health sector?
Okay, I have really, I think this would be kind of perfect answer, right? I believe. It says this. We think that taking a computer or implementing an application in a hospital will give the results. I believe it is not. Implement any kind of computer application, you have to make the environment to implement this application. So making the environment means changing the mindset of the health staff, changing the environment of the health staff, rearranging the process, and so forth. Once you come to that stage, once you do all that, like doing all business processes into the optimal stage, right? Then that in the optimal stage, changing the mindset of the health staff, training them. At that time you can implement. But without doing all required, we try to implement, just dump a computer and the application, and we sometimes ask them to use the computer. So, this is the main barrier. I think this is the reason for the earlier failures. So I think we have to be really prepared for any kind of computer application.
Our question from Pradeep Pereira. It says, as we all know, BHT, the bedhead ticket, is a legal document. Will there be any legal issues in implementing EHR solutions in Sri Lanka? Is EHR legally recognized in Sri Lanka? As
well, I understand.
Legal document. Yeah. Okay, thanks.
This is sometime a discussion we also had. The one what you raised is a concern we also have right now. At the same time, we have spoken to the legal draftment department, and we are right now also discussing with this matter with the experts. Yes, BHT is a legal document. At the same time, we need to be mindful. Sri Lanka is Sri Lankan Electronic Transaction Act is now. We have that act, right? It covered most of the secure transaction. If you are implementing any kind of solution, right, it is covered under the Electronic Transaction Act. That should be legally accepted. So I don't have one particular answer. I believe that most of are through the Transaction Act. At the same time, we also need to get the stakeholders' consent, especially the legal draftment department and the Ministry of Health, to implement the BHT, electronic BHT.
Okay, we question from Samir, just a clarification. He asked, will all those 45 hospitals start issuing personal health numbers, PHN, in 2016?
In the question, yes. We are going to implement the person, it is called Master Patient Index, parallel to the for hospital implementation. At the same time, we are going to use the the algorithm which was developed by the Ministry of Health, and especially it was developed by and conceptualized by Dr. HHIMS. It will be implemented in the Master Patient Index, and there will be a web service to call a Master Patient Index and get the patient information number or the health information number.
Okay, moving on to the next question. It's from Kasun Gamake. It says, has there been any attempts of adapting open source solutions for EHR systems in government hospitals Sri Lanka? For example, OpenMRS. What is your opinion on this?
I said HHIMS also free open source system, not only the OpenMRS. We actually reviewed the OpenMRS in 2010 before implement the HHIMS, and we reviewed analyzed the workload of the customization of the OpenMRS for of the government hospital. It was done by the ICTA technical team, and found that there was a system which was implemented in Eastern Province, and GUI, user graphical interface, also accepted by the government hospital doctors to use same kind of user interface and do the database design from the scratch and write the code from scratch. So HHIMS is also a free and open source system, and is now being published in the GovForge, forge.ic.lk, and there are two files, one for the hospital and one for the private medical practice.
Then there's another question that is also from Kasun Gamage. He has two questions. First is, can HHIMS be used in general practitioner setting? And the second question, can HHIMS be used in other countries? It's both freely available.
Answering two questions, yes. For the general practitioners, we have customized the HHIMS for fitting the general practitioners. That file is called, that software is called EMC, Electronic Medical Center, and you can download the EMC system from the govforge.lk. At the same time, since it's a free and open source system, it is available for any country to implement. We are like to build the capacity of the private sector or any organization to implement the HHIMS in any part of the world.
Okay, moving to the next question. What is the sustainability of HHIMS since it is being developed by a private company? Has the ICT development community to support HHIMS?
Answering the question, yes. It is initially developed by the ICTA, and it was initially developed by the private company called Luna Technology, and it was a grant given to the RDHS, and the right of the system, the copyrights or the license was with the ICT, and subsequently the license was published under the AGPL 1.3. In 2015, the ICT again published the open tender for customizing and implementing the HHIMS in new platform, and again the ICT proposed to use any open source framework, and 2.0 version was published under the and the framework which was used is coordinator. Also, the system is mainly managed by the ICA, and even the future, the release management and the software management will be done by the ICTA. But at the same time, we have an idea to have a community engagement on developing the the HHIMS into the stage. So have a plan to invite the private sector and the community and the individuals who would contributing for this system to engage on the system development. We will be publishing a separate site and the separate SVN for getting the contribution from the individuals as well as the private companies. So it will be community made system in future.
Thank you, and it's already past 1 p.m. and the eHealth is starting another eHealth hour at 1:30 Sri Lankan time, so we'll have to conclude. Sri, any final comments before we conclude?
Okay, as I said earlier, we really want to have the private sector and the individual contribution for the HHIMS development. At the same time, according to the topic I talked here, we have found that the eHealth solution have benefited the patient as well as the professionals in the hospital setting. So we have the responsibilities are on our shoulders to implement, like like you, private sector, the government, and hospital staff. So the duty or the responsibilities are our shoulders to implement and use the computer and the technology for the betterment of the patients. Thank you very much.
Since we have run out of time, we'll be concluding the 8th Sri Lankan eHealth hour for today. If you have any further questions to ask from Sri, please feel free to forward them to us. We'll make sure to distribute the source material and the answer to the question via email. And we would be grateful if you could also submit the feedback form that we'll be sending to you via email after this webinar. Please join us for our next Sri Lankan eHealth hour in February. If you are an expert in health informatics and willing to share your experience with the eHealth community of Sri Lanka, we can arrange you a session at Sri Lankan eHealth hour. Please feel free to contact us. Again, we are really grateful for the presenter today for sharing with us valuable information, and also Dr. Roshan Hewapatin, the CEO of his and my colleague Dr. Megha Ganewatha, who is with me coordinating eHealth hour from his. Finally, I must thank all our attendees from around the globe. See you in